Welcome to Dr. Nasreen's Academy. In previous video, I've named out the management of hemorrhoids or piles. I have named out the operative techniques. So in this video, I'll be explaining the operative techniques which are used in the management of hemorrhoids or piles. So in operative technique, most common operative technique is hemorrhoidectomy, which is again divided into closed or open. Closed one is developed by Ferguson. Therefore, it is known as Ferguson hemorrhoidectomy, and open one is developed by Milligan and Morgan. So first, open hemorrhoidectomy. I'll be explaining the open hemorrhoidectomy in a flow chart, and in succeeding slide, I'll be showing the pictures of the open hemorrhoidectomy. So in open hemorrhoidectomy, the anoderm and subcutaneous tissues between the pile masses are injected with dilute adrenaline. Uh, it will reduce the bleeding and it will act as local anesthesia. Then artery forceps are applied to the skin covered with external components of the piles and traction exerted to reveal the internal components. Then those are also grasped by the artery forceps. So three pairs of artery forceps are used for 3, 7 and 11 o'clock position pile mass to form a triangle. And then with the help of scissor or cutting diathermy, a V-shaped cut is made through the skin. And traction is applied by both the operator and the assistant, and with combined careful dissection is done, which will then expose the lower border of the internal sphincter. As you can see in the figure, the triangle shape is formed by using artery forceps. Then the dissection proceeds up the anal canal with the sides of the mucosal dissection covering towards the pile apex and with the internal sphincter visible and separate from the dissected pile. And in this condition only, here at this position, a transfixation ligature is done using a strong vicryl. The pile is excised well distal to the ligature, and after ensuring hemostasis, the ligature is cut long. So each hemorrhoid is dealt with this manner, taking care to leave mucocutaneous bridges. Now starting with closed hemorrhoidectomy. Here the hemorrhoid is excised together with the overlying mucosa, and I'll be illustrating it in the succeeding slide in figure. Also, the hemorrhoid is dissected carefully from the underlying sphincter and artery forceps is achieved. The pedicle is transfixed and ligated with vicryl or dexon, and usually 30 vicryl or dexon is used. Any residual small hemorrhoids should be removed by filleting them out after undermining the edges of cut mucosa. The mucosal defect is then closed completely with a continuous suture using the same stitch that was employed to ligate the hemorrhoid pedicle. So here the difference is that the mucosal defect is then closed completely. जो mucosal defect है उसको completely close किया जाता है using Dexon or Vicryl. The remaining hemorrhoids are excised and ligated in the same fashion, ensuring that there are adequate mucosal and skin bridges between each area of excision to avoid a subsequent stenosis. So as you can see in this figure, this is closed hemorrhoidectomy developed by Ferguson in A, B, C and D. In D, the mucosal layer is totally closed with the help of suture. Though this is a very common method, but there are few complications which is divided into early complication and late complications of hemorrhoidectomy. Early complications include pain which may require opiate analgesia, retention of urine especially in men which rarely may need relief by catheterization, and reactionary hemorrhage which is much more common than secondary hemorrhage. The hemorrhage may be mainly or entirely concealed but will become evident on examining the rectum. Late post-operative complications include secondary hemorrhage. This is uncommon, occurring about the 7th or 8th day after operation. It is usually controlled by morphine, but the hemorrhage is, if it is severe, an anesthetic should be given and the bleeding should be controlled. Anal stricture, anal fissure, and incontinence are also the complications, late complications of hemorrhoidectomy. So next management technique is steppled hemorrhoidopexy. With the aim of symptom relief but preservation of anal cushions, the technique of steppled hemorrhoidopexy was designed. So in this technique, what is done is a purse string suture is placed several centimeter above the dentate line, usually 3 to 4 centimeter above the dentate line. The anvil of the fully open staplic gun is inserted endo-anally so that it is above the purse string suture, which is then tied around the shaft of the gun. The gun is closed and fired. After firing, a 3 to 4 centimeter strip of mucosa and submucosa containing the hemorrhoids is excised. The mucosal edges are simultaneously stapled together. So you can see in this figure here, the purse string suture is placed several centimeters above the dentate line. The envelope in second figure, the envelope fully opened staplic gun is inserted endo-anally so that it is above the purse string suture, which is then tied around the shaft of the gun. The gun is closed and fired. After firing, a 3 to 4 centimeter strip of mucosa and submucosa containing the hemorrhoids is excised and the mucosal edges are simultaneously stapled together. Results of stapled hemorrhoidopexy are varied. A meta-analysis was done of RCT randomized control trial, which showed that this is safe. This is a very safe technique, but it was associated with very high recurrence rate. Up next technique is Up next technique is Shar Sutra therapy, medicated sit-on, which is very much popular in Ayurvedic science, wherein a medicated thread is ligated over the pile masses and it is left there for few days. And after few days, when the medicated sit-on cauterizes chemically and mechanically cauterizes the pile mass, and the pile mass shred off automatically. This is how Shar Sutra therapy works. The effect of Shar Sutra on local tissue stimulates active granulation with capillary formation, fibroblastic proliferation with collagen formation, epithelial hyperplasia is there, which endorses early necrosis, followed by active granulation is possible only with the novel drug delivery system of Shar. Up next video will be from the topic anus and the anal canal only. Don't forget to like, share and subscribe my channel. Thank you.